My name is Makaela Newsome, and I am a second-year community health science in the MPH program at Fielding School of Public Health. So this summer, I spent my internship in Kampala, Uganda, working with Kagezi Healthcare Foundation. I worked primarily on their rabbit breeding project, which was a nutrition and economic intervention for families, as well as implementing the World Health Organization's Safe Childbirth Checklist into their new maternal clinic. But that's not what I want to talk about tonight. So what I'd like to speak about tonight is our roles as future and public health professionals in an age of volunteer medical tourism. I'm going to start with a quick story. So there was a cervical cancer outreach in a village a couple miles north of the Kampala main town center. During this outreach, there was public health interns, nurses, doctors, and even a couple of physician assistant undergrads. While there, the women were able to get their cervical cancer screening done and then be moved over to ask if they'd like to participate in a survey about cervical cancer attitudes and perceptions in the village. During one of those surveys, we found that it was established that it was okay for some of the physician assistant students to practice giving cervical cancer screenings for the first time on the women at the outreach. During one of the surveys, we found out that one of the women had extreme and excruciating pain. When we asked why, we found out that it was actually one of the physician assistants who had done her screening, and we theorized that they might have accidentally jabbed her in the cervix. So this is a pretty benign example. The student probably, hopefully, didn't do any real damage physically. But what they did was just as harmful. They've now created for this young woman an image that preventative cervical cancer care is both painful and uncomfortable. And while we may never know if that was enough for her to never come back, we do know that she will spread her experience to those close to her and to those in her small village, making a further barrier for women in that area to seek preventative care. So I have countless other examples, frankly, much worse than that I've had from my experience and the experience of my classmates and colleagues. So I'm using tonight as a little call to action. I'm asking us, as public health professionals, we have a duty and an authority to call this out and to intervene. And our institutions have a responsibility of sending out ethically trained students who understand their scope of practice and what it is and what it is not. We are all in this profession because we want better health for all people. And unfortunately, we come from a place that has a legacy of medical and health-related experimentation and misconduct, especially in low-income countries primarily populated by people of color. It's time for this to end, and we can stop this legacy. It can end with us. So tonight I'm asking you, when you see something in your career or life, say something, ask questions, be nosy, dig around, and simply be unafraid. We chose this career. We chose this responsibility. So let's please give it some justice. Thank you.